Hello, Dr. Cisse covering anatomy and physiology. Today I will talk about the pathway of blood in and out of the heart. Okay? So this is the heart. It'll be tilted to the left side, the apex and the base. So this will be the left and the right. So that's going to be the left atrium, the left ventricle, the right ventricle, and the right atrium, right? So we're going to have the valves here, tricuspid valve, mitral valve, okay? And then I will have the superior vena cava, inferior vena cava, right? Then we're going to have the pulmonary trunk. So I'm going to make this pulmonary trunk divided into right and left pulmonary arteries. Then we'll talk about the vein coming back, okay, from the lung. Now here you see the superior vena cava, inferior vena cava. Blood from your body will come to this vein to the right atrium. From the right atrium, blood will come to the tricuspid valve that opens to go to the right ventricle. From the right ventricle, so I'm gonna kind of divide the heart septum here. From the right ventricle, blood will go through the semilunar valve into the pulmonary trunk, then go to the left pulmonary artery, right pulmonary artery to the lungs. Then from the lungs, the oxygenated blood will come from the lung to the left atrium, right? It's gonna come to the left pulmonary vein, and the other side will have the right pulmonary vein. So blood from the lungs will come to the vein, to the left atrium. From the left atrium, will come down through the mitral valves to come down to the left ventricle. Then the left ventricle will squeeze, like will contract to push blood out of the aorta through the semilunar valve. Again, superior vena cava, inferior vena cava. Also, we're gonna have the sinus, the opening to the coronary sinus, which has the blood of the heart itself, like here. So I'm gonna put that one here. All this blood will come to the right ventricle. In the right ventricle, go through the tricuspid valve, and when the ventricle contract, it will push blood out of the right ventricle through the pulmonary trunk, then to the pulmonary arteries. Now, both of them will squeeze at the same time. That's why blood from the right ventricle will come out through the pulmonary trunk to the lung, and blood from the left ventricle will be pushed out through the aorta to go to the body. When blood goes from the right ventricle to the lungs, right, and come back to the left atrium, that is called the pulmonary circuit. But when that blood comes down to the left ventricle and be pushed out through the aorta, through the semilunar valve, to the body to give oxygen to the whole to the body, when it comes back through the superior inferior vena cava, that part is called systemic circuit. So the pulmonary circuit takes the blood from the right side of the heart to the lung and back to the left side, like the atrium, and the systemic circuit will take it from the left atrium to the left ventricle to be pushed out to the whole body to come back through the inferior and the superior vena cava. All right, so that's gonna be the pathway of blood from the vena cava to the atrium, to the ventricle, then to the pulmonary trunk, pulmonary artery, to the lungs, and come back to the pulmonary vein, coming back vein, and then got down to the left artery, atrium, left ventricle to the aorta to hold the body, and the circle will come back again. All right, thank you for watching, and I'll see you in class.